From day one, it was about the bigger picture. It wasn't about electronic medical records or even meaningful use. It was about transforming the healthcare system. There's been lots of confusion across the healthcare spectrum around meaningful use, quality metrics, whether they be PQRI or other things from CMS. And what the REC has been able to do is translate that for providers and help them navigate the complexity from meaningful use in HIE to real quality improvements in healthcare delivery.
We've never felt like just because we got an EMR that somehow we were finished and that we could kind of stop progressing. Our latest adventure is that we've met meaningful use, and then our next goal is to make sure that we can join the HIE and make sure that patient information is transferable and transparent. And then from there, we're continuing to work on patient satisfaction and outcomes data, and then seeing where healthcare in Maine is going to go in terms of the ACOs and making sure that we're a part of kind of wherever healthcare in Maine is going.
We're one of the first RECs in the country to hit our enrollment target. We're also the only REC that I know of that required our providers to go under contract with a supported vendor before enrolling in the program. This took additional time up front, but we believe our providers will more quickly meet milestone 2 and 3 and eventually meaningful use.
There's an independent do-it-yourself culture in Maine that our healthcare providers and organizations follow too. So unlike a lot of the regional extension centers in the country, we chose not to charge for our services. And instead, we passed on the majority of the grant money to our providers.
We only have a few full-time employees here at the REC, and Maine is a large rural state. So we really needed to get creative in order to meet our enrollment goals. That included sending a lot of emails and spending a lot of the time on the phone just answering questions for providers. And we also held webinars so that providers could educate themselves about EHRs and the REC on their own time.
Managing a medical practice, you need to be an expert in a lot of things, and half the time it is just knowing the right people to ask the questions of. So we have a electronic health record. We are not specialists in IT. The security guidelines, besides all the clinical part of meaningful use, the IT part was a little overwhelming. It was clear that we would need some expertise and help. So we turned to Gemma at the HealthInfoNet to help us with that specific objective. The more we read, the more we realized we couldn't do that one ourselves.
We focused on giving the providers the resources they needed when they needed it to help them reach their goals on their own terms.
More than 70% of healthcare providers in Maine are employed by hospitals or health systems, so we partnered with their employers to move them through the milestones. We've also required that the providers connect with Maine's Health Information Exchange as part of the third milestone. In fact, connection to the HIE is one of the reasons providers chose to enroll with HealthInfoNet in the first place, particularly rural and independent providers.
Coastal Women's Healthcare is a progressive, innovative group of physicians who have worked hard to remain independent. In today's environment, that is very challenging. The trend is not towards practices being able financially to stay on their own, and we've worked hard at that. One of the challenges to being a small private practice is connectivity and sharing your data. We looked at our connectivity to HealthInfoNet as another way to stay connected and allow us to stay independent and stay in the game.